So in this video, we'll be talking a little bit about measuring forces and how we'll be measuring forces in this class. So a few kind of reminders to reorient you to this kind of frame of thinking, starting with some things that you should really know. So we know that a force is a push or a pull that causes linear movement. So body weight is a common example of force that's directed downward due to the mass of a person and the gravitational effect of being very close to the mass of the Earth. Some good things to recall from previous courses like physics or biomechanics. Force is not typically constant, but varies with time, and many forces are usually occurring from different directions, both internal and external, that govern the movement of the body. So a key or a clear example of dynamic or changing force during movement is the ground reaction force to body weight during a vertical jump. This can be measured by jumping up from, landing on, and landing on a force platform that creates a force by time plot of the ground reaction force that you can see here. So the force by time plot here shows the variations in the vertical force, that's typically measured in newtons, during a counter movement jump. Being able to observe the changes in forces during such an event can lead to improved understanding of performance enhancement and injury prevention strategies. So you should be familiar with this force by time plot if you took biomechanics with Dr. Hayworth. You'll also be seeing something like this in class this semester. So the next thing that you should know is degrees of freedom. So this refers to the number of unique components in a system. In context of force measurement, this refers to the number of directions that force is measured at one time. In the example of counter movement jump, only the vertical force is shown. So this is a one-dimensional force plotted against one-dimensional time. In gait, however, 6 degrees of freedom is more common, describing the linear forces in the vertical, anterior, posterior, and mediolateral directions, as well as rotations around those axes. These are all displayed in the figure here. So keep in mind that each joint of the body has a mechanical design that affords certain rotations. So multiple linkages afford more complex movement. For example, the hand is able to move due to the wrist, the elbow, the shoulder, and even trunk rotation. Be mindful about describing movements of the body in separate terms of joint rotations, like elbow flexion, or segmental motions like rotation of the forearm around the elbow. Both are valid, but consistency is valuable here. It may also be a good idea to review some anatomical terms, including bone and muscle names and names of various joint rotations for this class. So let's get into measuring different forces and what can be used to do that. In our lab, we have AMTI force plates that are 6 degrees of freedom. So that's this top left image. We also have B.E.A.R force plates that are 1 degree of freedom. The AMTI force plates can be used for gait, posture, vertical jump, or even simple reaction time. We'll be using it for both vertical jump and reaction time in lab reports in this class. B.E.A.R plates are specialized for measuring postural sway. There's also other devices like the Fidget's S-shaped load cell, which can be used to measure tension or pulling forces like tug of war, and also hand grip dynamometers, which can be used to measure grip strength, which may be a simple proxy of overall strength. So forces can be measured in a variety of ways, 2 of which you'll observe in this class. So now we can talk about balance assessment. So balance is a person's ability to stand and be mobile without falling. When it comes to balance assessment, we can look at things like postural sway or postural control. So postural sway, which is the movements of the body during standing and sitting, typically this is measured using force plates, but can also be measured using video-based motion capture or inertial measurement units. like what's in your phone that lets it detect when it's being moved. So something like postural sway occurs due to the inherent dynamics of the human body. So your heart rate, blood pressure changes along with breathing means that your body's never really still. The mass of the blood and the chest move all the time, as well as the muscle forces that cannot be exactly constant, and thus the body must be continuously in motion. So the second aspect here is postural control, which refers to the processes of the neuromuscular system to coordinate the movements of the body in order to maintain balance. So how this motion is controlled can be organized from three primary sensory systems. Vision, which of course is what we see, proprioception, which is things like the touch sense of the feet, the muscle spindle fibers, and Golgi tendon organs, and the vestibular system, which is the inner ear mechanism that detects head motion in 6 degrees of freedom. The effectiveness of these systems at maintaining control over posture is a measure of postural control. So specific to this class, to this lab and our class, our AMTI force plates are able to measure 6 degrees of freedom of force data. From this, you have the forward and backward and lateral motions of the body around a center of pressure during standing that can be calculated and evaluated. Next is the B.E.A.R force plate. And the software that goes with it. This is a customized device that uses 1 degree of freedom sensors, one in each corner of the plate, to deliver messages or measures of the center of pressure. This software provides many specific protocols that are listed here that assess various aspects of postural control. So why this is all important? This is important because assessing postural control allows for early detection of balance impairments, leveraging the various protocols offered by the B.E.A.R system. Many aspects of postural control can be evaluated. This kind of nuanced assessment affords tailored and trackable physical medicine. So for one example, the MCTSIB modified clinical test of sensory motor integration in balance, which is one of the protocols of the B.E.A.R. This protocol can be used to evaluate the sensory system's health of a person with, say, type 2 diabetes. And from that, you can determine if proprioception or vision are impaired by this metabolic or vascular disease. So that's just one example of how this equipment can be applied to a more clinical setting. So that's the summary on force, how it's measured in this class, and why it's important.